Good morning, everyone. Thank you for the introduction. Thank you, Steve. I'm always glad when people do statistics, so I don't have to. As Meg said, my name is Alanna Badgley, and I am a paramedic. I am here to bring you a message from the collective voice of the EMS provider. I am lucky for a lot of reasons. One of them is that I have the distinct privilege of representing literal heroes. As a paramedic and union president of 900 EMS professionals, I get to watch my coworkers save lives each and every day. And I also have the privilege of doing the same. Just last week, I was dispatched to save a man around my age who was found in a Target bathroom turning blue and breathing ineffectively. He was just barely clinging to life and experiencing an apparent overdose on opiates, which is unfortunately a very common call these days. My colleagues provided him with supplemental oxygen, forcing air into his lungs with mechanical breaths, while I started an IV and delivered life-saving medications to him. But even after those initial medications were given, he still remained in critical condition, so we then had to sedate, chemically paralyze, and intubate him. While we placed a tube into his trachea to breathe for him, on the floor of a Target bathroom, our patient turned from blue to pink, a sign that told us that oxygen was now circulating to his brain and other vital organs. It was only then that we started to lift him from the floor, put him on our stretcher, and start our transport to the hospital. We bring hospitals to our patients, and we save lives by doing so. Right now, life-saving is happening in the hands of EMS professionals everywhere around us, in homes, in restaurants, on highways, and on playgrounds. As I speak, lights and sirens are being used to respond to medical calls around this state. Overdoses are being reversed, heart attacks treated, and seizures stopped. Right now. When you have a medical emergency, you can dial 911, and heroes can respond in an ambulance. Right? That is the promise that our society has made to us. That is what we all expect. In many cases, it's still true. But that promise is also being broken every day. Around this state, people are also calling for help when no one is nearby or available to respond to their emergency. The way things have been working now, someone might wait hours for an ambulance, or one might not come at all. This is true in both the urban areas and the rural ones. For my patient in Target, that would have been the difference between his life and his death. You could say that he got lucky. Our unit happened to be in service and close by, and we were helping him breathe within 5 minutes of being called. But imagine for a moment, what if we weren't? Everyone in New York should get to be that lucky. Fate and local budgets should not dictate whether or not a life is saved. When we say make EMS essential, what we mean is live up to the promise that an ambulance will arrive when someone calls 911, that lives will be saved in the process. The EMS practitioners in this state want nothing more than to live up to that promise to our neighbors. But we must do so in a sustainable manner that does not break us down bit by bit in the process. The EMS system is broken. The system has been collapsing for years because we, as a society, have allowed it to. We've created a third-class system that is largely unfunded by the public, even though it is a publicly expected service. As a result, the providers themselves have also been devalued and blocked from a viable career of service as an out-of-hospital healthcare provider. We are an afterthought on budget lines, which is internalized not just by us, but by everyone around us. You will be hard-pressed to find someone out there who will say, I want to be a paramedic when I grow up. Even paramedics don't want to be paramedics when we grow up. Everyone I work with has an exit strategy of some kind. Very few of those plans involve sticking around for 30 years to have a relaxing retirement. We are also broken. We are demoralized, we are tired, we are sick of being treated as third class and watching our communities suffer as a result. We can do better. We deserve better. So we must begin the process of fixing the broken system of EMS. And that starts with making EMS essential by creating funding structures that are sustainable and equitable, with offering more resources to the providers in the field. It starts with the legislative package proposed by NYSAC to rescue EMS. With this package, we can begin to ensure the equitable delivery of pre-hospital health care in every corner of this state. And in the process, we would be supporting the selfless EMS professionals in each of your counties who are out there every day saving lives against all odds. But don't take my word for it. When you go back to your districts, meet with your local EMS agencies and providers. Hear it directly from them. Ask them what they need. What would it take to keep your doors open and providers supported? Listen to the stories the heroes in your communities tell you about the lives saved and the lives lost. And then ask yourself what a life in your county is worth. I don't know what happened to my patient from Target after I left him in the ER. If he's like the vast majority of the many thousands of patients I've treated in the last 14 years, I'll never know what happened to him. What I do know is that he got the best shot possible at a continued life. Because I, a human being with the skills, knowledge, and bravery required to save his life, happened to be available and close by when he had his emergency. Please do what you can from your capacity to help us fix this broken system so that everyone else in this state is just as lucky. Thank you.